Right, everybody. We waiting any officers, Louise? They're all here. Right.
Yes.
Right. I thought I had Kirsten Mackenzie there. Right, okay. We'll start the meeting officially. So, hello and welcome to the Health and Social Committee. Do we have any apologies, substitutes and declaration of interest? Jim?
Sorry, we have no apologies. Are there any declarations of interest?
Chair, can I make a declaration of interest for item 4 on the Board of Riverclyde homes?
Yeah, convener, I'd like to declare an interest under item 4 as a non-executive director of Parkway branching out.
Chair, I'd like to make a declaration under item 4, a close family member working for Alzheimer's Scotland.
Thank you for that.
Chair, can I make a declaration under item 4 as a board member of Financial Fitness?
Right, if that's all the declaration of interest, we can move on to the business. As you know, it's a expedited meeting, but having said that, the recommendations are running the papers from 4.1 to 4.13, and it's generally it would be agenda without the full agenda. So, without any further ado, can I move on to 4.1, which is the Community Assessment Centre, and who is going to say a couple words about this?
If it's okay, through yourself, convener, I will open up and then I'll just explain how we're going to do the report, if that's okay, because there's quite a lot in the report.
Okay.
So Alan will talk about most of the areas in relation to health and community, talking from 4.1 to 4.8. Then Anne will give, and he'll stop halfway after he starts about care homes and take any questions. Then we'll move on to Anne, who'll give an update in relation to the Alcohol and Drugs Recovery Service. Alan will come back in and give an update in relation to the Learning Disability Hub and the Adult Support and Protection Inspection, although that is subject to a report in its own right. Sharon will give an update in relation to the promise, and then Samantha will give an update in relation to the period 11 health and social care. Obviously, members can stop at any time and ask questions, but the officers will pause each time we stop to hand over to people.
Right, thanks, Louise. You can just keep me right in if I get the wrong officer. Okay, so the Community Assessment Centre, is Alan?
Thanks, convener. Through yourself, this is a COVID update, so I'll just work through quickly each paragraph and I'll stop at the bottom of the page if that's okay. Starting off with the Community Assessment Centre up at the Greenock Health Centre. Yep. Demand remains extremely low. We're in a very fortunate position and has been for a number of months now in terms of the use of the Community Assessment Centre. We are looking to pause that from next Thursday with the view to stepping it back up again if that is required. The GP cover, usually twice a week, these GPs will go back into their own practice and pick up the increasing demand in primary care, which is occurring now. So that will be kept under review. We'll stand it down as we've done previously, but if the infection rate was to increase again, we'll be in a position to step that service back up again if required. Under item 4.2, in relation to the COVID response, we continue to work hard in relation to the vaccinations, and you'll note that the 13 care homes have received both sets of vaccinations now, and all I can say is it's made a considerable difference to the morale and how safe people are feeling in the care homes in Inverclyde, and it just feels as if we're coming through this now in relation to the residents and their families. Under 4.3, the assurance and support to care homes, they're still spending a significant amount of time working with the care homes across Inverclyde, continue to have a focus on infection control, issues about PPE, staffing, making sure the care homes are receiving the support that they require, and that work remains ongoing. I still meet with the care home managers every second Wednesday, and we go through a set agenda just to pick up any issues. And I'll go on to talk a wee bit about the assurance visits as well. As it stands today, all our care homes in Inverclyde are open. They're open to meaningful contact and visits. And in terms of their, if you like, their RAG status under public health, they're all green. We have no red care homes in Inverclyde, so they're all open to meaningful contact, and families are now enjoying that contact with loved ones.
Alan, that's fine. Could maybe anybody get any questions on that, the first page, 4.1 to 4.3? Jim, have you got any questions for Alan on it?
Yes, on 4.3, thanks, Convener. Regarding the second bullet point, only one care home is not open to admissions, and this is due to a decision by the provider and not due to external factors. I mean, obviously, it's I'm a bit concerned, obviously, that you know, residents are still unable to see loved ones, and loved ones are unable to see their family members. Obviously, I can understand that you know, some care homes might have been hit harder or affected harder, should I say, during the pandemic, and perhaps maybe this is some reasons for you know, more hesitancy to open up again and allow people in. I don't know if that's the reasoning behind this one or whatever, or maybe there's an issue about confidence or whatever. But do you have any indication at all when the care home, this particular care home, will be able to open up again and allow loved ones in to see their families?
Thanks, Convener, through yourself. Just to let you know, since the report was written, the care home has indeed opened back up, Councillor MacLeod, so all the care homes are open to meaningful contact now.
That's good news. Thank you for that. Thank you.
Can I just say before we move on, if any other member would like to ask a question, to use the chat function, and also I'm going to show up, because I already found out yesterday myself how to use the reaction button, which is even easier. So either way is fine with me. You know, reaction's quite good actually. Oh, well done. So moving on to the next page.
Convener, I've just put a wee up there.
Sorry, Rich,
it's just regarding the care homes, because I think there should be a big thanks to our staff as well as staff in there, because it wasn't easy shutting the doors for the safety of the people on the inside, because some people may not realise that and their clothes are bringing us these germs in. And what we've got to look at though, and I've said this through it, is we're actually using video link ups, and I think some of the people on the inside, it'd be something worthwhile looking at. If this ever happened again, at least the person on the inside and the person outside could talk to each other and see each other, even if it was a pre-arranged time to get in at, I'd let them see, rather than them feeling, I've not seen anybody for 6 months or whatever else, at least they would see them. But I think that the staff that worked with them and virus has been tremendous.
I think we know what their thoughts, Councillor Becker.
You know, so thank
Alan, I think Councillor Becker wants you to pass on our thanks to all your staff, Alan, under the circumstances that worked over this pandemic, and we could never done it without them, so a well done to everyone. So we'll pass them our best wishes on to all your staff.
No problem, Convener, thanks, and thank you, Councillor Becky, for those words. Under 4.4, enhanced support to care homes, Sharon's been negotiating on our behalf as Chief Social Work Officer through the Chief Social Work Advisor, and we've started a round of assurance visits and reviews for all residents in care homes. As part of that assurance, there are a number of levels to that. We have qualified social workers and nurses going out to do a level 1 assurance, or service managers then review that information, and Sharon as Chief Social Work Officer, myself as Head of Service, and Deirdre, our Chief Nurse, have all been out doing follow-up visits. I was up at Marchmount Care Home on Friday doing an assurance visit and met with the unit manager and the staff, and got a walk round and had a look to a chance to discuss COVID issues with the staff and how the residents are. So that visit went very well, and we are 3/4 of the way through those assurance visits. So we're in a strong position to give everyone a level of assurance around what's going on in the care homes. And as well as that, our assessment and care management teams are carrying out reviews now for all the residents in care homes who have not had a review in the last 6 months. So that really gives a thorough sweep of all our residents in care homes in Inverclyde, and we've started that process, and that's been led through the Chief Social Work Officer Advisor, and the same in the nursing side from the Scottish Government in Inverclyde. We've combined those two asks, and we've come up with a process to make sure these assurance visits are undertaken. Under 4.5, you'll notice that Gabriel Woods is now secure. The shutters are up. The residents have all moved on to their new placements, and I'm happy to report that people are settled in their new placements, and we've stepped back from that negotiation now. The Sailor Society will be what they term phase 2, is moving on to look at those with an interest in the property. I did ask the Chief Executive to keep us up to date with that, and so far there hasn't been any further updates in relation to how far on they are in that process, but certainly the place has been fully secured and the residents have all moved on.
Yeah.
Just under 4.6 for day services in the respite unit, people will know there's still a huge level of anxiety around for families of older people, but as part of the current work we've been doing in relation to the assertive outreach at Hill End, we are going to undertake an evaluation of that just to look at what went well, what families have appreciated about us having a slight change in the model in relation to day services, and we'll come back to the committee with an update on that as we start to move through the recovery phases. Members will remember on learning disability, we were able to start up a small, modest service in relation to learning disability, and that's been going well. So we're going through a process, and the same for day services, but we are going to take the chance to review the work that's been done in the assertive outreach, and we'll report back to the committee at a future date. The demand for respite is still not registering yet. The families are not keen for their loved ones to be going into buildings at the moment. Again, I will come back once we see some level of demand starting to appear, but as yet carers are still content to receive some respite at home and are not so keen for their loved ones to go into a building at the moment. And finally, under 4.8, we are almost there in relation to the new Greenock Health Centre. All the staff have been up to do their visit for their orientation. There's teams in building the desks and all the equipment that's required. The electronic arms coming in for the new pharmacy, which looks fantastic. So that's all taking shape, and we're on schedule for the team to move in 11th and 12th of May. So all that work is continuing to go ahead.
Thank you, Alan. I think Councillor Jackson's got a question for you on the health centre. Councillor Jackson.
Thank you, Robert. Like Alan, I mean, I'm really pleased to have this new health centre built. It's a great facility, and I'm really glad it's in my ward, and it's going to really add to the benefit of the ward. But I must admit, I'm really disappointed, Convener, with the so-called community benefits we're looking at within this report. These community benefits were negotiated by West Hub Scotland on behalf of the Scottish Government with the contractor. You can maybe just bear with me a wee second, Robert. I'll give you tell you why I'm disappointed with this. Now, within this report, an example is we've got 25 apprenticeships. Now, I'll give an example of these apprenticeships. An apprentice electrician from Motherwell, an apprentice electrician from Clydebank, an apprentice electrician from Glasgow, 2 apprentice plasters from Bells Hill, 1 from Shettleston, an apprentice engineer from Stirling, an apprentice engineer from North Lanarkshire, an apprentice electrician from Shawfield, 2 apprentice joiners from Falkirk, 1 foundation apprentice from Glasgow, 2 trainee scaffolders from Glasgow. At the minute, the contractor in West Hub Scotland will not come back and tell us how many small, medium enterprises from Inverclyde
get access to the work packages. Now, considering this is a £19 million project, convener, and you look at the way this is worded, you could be wrong in thinking this has benefited the young people of Inverclyde to give them apprenticeships to try and help them secure a future. This is deeply, deeply disappointing. Now, the Scottish Government and the West Hub had the chance when they negotiated this contract to make sure, and the clues in the name, community benefit, that some of this benefit would have helped the young people of Inverclyde, but there's nothing here. 11 new employment opportunities. These 11 new employment opportunities were basically 5-6 week labouring jobs for locals. That was about that. That's about the amount of the local community benefit. Now, I just want to get this on record, convener, how disappointed I am that £90 million has been spent and there's not been one job, there's no employment legacy for any of our young people. I just want to get that on record. Robert, thank you.
I think going and also about your superior knowledge again, you know, that's quite a comprehensive list you have there. But I have to say, seeing the report, the impression I got it was local as well, Colin, and I'm disappointed, but that we are where we are on it, you know, it's finished now, so we just have to make sure that in future we're more firmer in asking them, especially with the garden going to be built, you know, the adult learning disability building going to be constructed, so we could maybe look to the future and try and get them to take local people on, because that'll be a big project as well. And you're right, it's not good if all the benefit is leaving Inverclyde.
Robert, we are investing in the Ocean Terminal, and our officers have got community benefits written in there, and they're looking to secure local apprenticeships on a £6 million project. This council are investing £6 million into employability to try and help secure 200 jobs. These figures pale into significance to this £19 million project on behalf of the Scottish Government. West Hub Scotland negotiating on behalf of the Scottish Government. Regionally, this area have lost out again, and it's very, very disappointing. That's as much I've got to say on it, Robert. Thanks very much.
Right, thanks, Colin. I don't know if it's difficult for our author to respond to that. You want to try, Elise? I don't know. You want to say something on it?
Through you, convener, I'm happy to. Councillor Jackson's obviously got the information that was given to us from BAM in relation to, so that's where some of the detail. I'm happy to do a bit of analysis and then maybe send something round, because we only got that information this morning or yesterday, late yesterday. So I'm happy to do some analysis, because there's numerous sheets in relation to about the activities that they engaged in. But if we can get a bit of time to do some analysis, I'm happy to send a kind of update, composite update around people.
I know. I say going forward, you know, the learning disability hub getting constructed at the old Bath site. It'd be interesting to see if you could kind of secure some real local benefits on it. But that might be above our pay grade, but it's something I suppose we could look at going forward.
Absolutely, councillor. Through yourself, we can look at that in relation. We'll look at that with Stuart and his team in relation to community benefits. And obviously, I can see a number of community benefits in relation to Inverclyde, but I wouldn't want to comment in relation to that until we've had a bit of time to analyse it.
Thank you. Graham, Councillor Brooks, question?
Thanks very much, convener. Can I associate myself with the challenges that Councillor Jackson has brought up? It is a disappointing situation that we see that we've actually developed over what could have been a fantastic opportunity, but Councillor Jackson has very adequately made the comment. The only slight thing that's left on my question at 4.8 is it refers to the intention that the garden within the new health centre is maintained by local community groups. There's lots of local community activity in the area, as Councillor Jackson will know. I think he's got the health centre. I've got the staff car park in my ward. The Broomhill Hub, Wellington Gardens allotments. There's lots of good things happening. But reading the report, I wasn't convinced.
Lost you, Graham. We appear to have a technical hitch again, everybody.
We might
we'll
want
have
to just pause for 5 minutes, Councillor Moran.
Yeah, I think so.
Through you, Chair.
Right, Jim.
I've got my papers on my council laptop, so I'm connected through the VPN, but I'm
Aye.
in the meeting through my standalone.
All right.
I just lost the VPN on my papers, so that's what everybody else. So there's been an issue with the council's VPN. Everybody's lost it.
Yeah. Well, I know how you feel. I'm in the office now, so
That's why I'm on the standalone.
we'll give it a recess for 5 minutes to see if we get everyone back. I think we have the option to carry on, Vicky. We're quoted, so if everyone's agreeing, we could carry on with the members present, if that's all right. Does everyone agree to that, or do you want to try and hold on? But you don't know when they'll be back in. You know, Councillor McLeod's still here as well, although he's on the phone, and I think we're quoted.
You are quoted, convener.
Okay. Well, in that case, we'll just carry on. So,
Through yourself, convener. As I said, I'm happy for members who had dropped off. I'm happy to do a briefing in relation to our newsletter in relation to the health centre and put some up-to-date information in it for others, and also offer for elected members, ensuring that we're being COVID safe, to have a tour of the health centre once it opens. And if there's any other questions in relation to the health centre, I'm happy to answer them individually in relation to elected members as well.
that'd be great, Louise. We have 2 questions from Elizabeth.
Thanks, convener. Graham, can I just check you'd finished what you were saying when you get cut off?
All right. Sorry, Graham.
Sorry, just because I realised you might not have, sorry.
I think my preamble had ended, Elizabeth. Thanks very much. I suppose the question was, local community groups, do we have one on board for this garden, or is that a dream?
Through yourself, convener, yes, we have a number of local community groups that are involved in the Legacy Garden. But as I said, what I'll maybe do is just do an update for all elected members about everybody's involvement in relation to it.
All right, Graham. Right, Elizabeth, you can fire in now.
Thanks again, Robert. The question that I had on 4.8 was about the employment opportunities, the work experience and things like that, and it was to kind of really see what impact that had in Inverclyde. And I guess I am kind of disappointed in terms of what Councillor Jackson has brought forward, but partly because, to be honest, it's been brought forward now at the end of the project when there's nothing that we can do about it. And if I have a question remaining, I suppose it's where's our responsibility? You know, if we're saying that this is something that was done with West Hub and Scottish Government, but we're going to celebrate this as our health centre, then it's either our health centre or the Scottish Government's health centre, and therefore, if there was an issue with the community benefits, us not being satisfied that that was being bringing a yield in terms of genuine impact in Inverclyde, then the responsibility is on us in terms of not having held people's feet to the fire on that. So I guess I'm saying we can't have it both ways, and if there is an issue, which there clearly has been, if Councillor Jackson's information is correct, and I've no reason to believe that it's not, then we need, where's our responsibility been in that, is my remaining question. There's that question, and then the question that I had was really on, the other one was on 4.5, which was about the Mariners' home. And I'm thankful, first of all, to Alan for making sure that the owners know that we're concerned about the building. I'm fully aware that the building issue is not, this is not the forum for that, but I'm still not really sure where any remaining questions or ongoing discussions about what's happening with the building, and pushing on that, what the forum for that is. So I would really like to kind of know that, because I don't want to be tedious to anyone. But I'm also aware that I don't want the Mariners' home to be either a wasted asset in Inverclyde or another arts guild that becomes a building that somebody else owns that then just gets burnt down at some point. So sorry, I'm probably being very grumpy here with my questions. But
we'll do the Mariners' home first, then we'll ask Louise to respond. Right, Alan? The Mariners' home.
Convener, through yourself, yeah, I can give some assurance in that the last conversation we had with the Sailors Society is there's very strong interest in this facility. We are having ongoing discussions because members will know there's a group of flats behind the Mariners' home, and we are aware of a number of families. In fact, Councillor Quinn made contact as well around this. We are actively dealing with a number of issues in relation to some of the families who are a bit concerned about what the plans are, and we actually know who the people are in these flats who will require our support. In fact, we've helped a number of people already think about, is it still right for them to stay there? So I still have an active link with the Sailors Society, although it's very much through courtesy that the Sailors Society are keeping us up to date. I'm more than happy to come back, and if any fresh information appears, we can add it to the update report at committee, just to give members assurance that the progress is being made. But we are actively engaged with a number of the adults who are living in the flats behind the building. But I've been given assurance that there is significant interest in the actual care home part of the building, and they're making progress with that. They're going through their legal processes, but I'm certainly happy to keep it on the agenda, and I can come back with any further updates. And more likely it will be when families contact the elected members, and if you can direct that to myself, I'll make sure that we make contact with individual family members and offer what support is required.
Yeah, thanks. I think I led by saying, you know, I mean, I've been down there just saying, you see them steel curtains up there now, you know, it distracts for the whole. I don't think by many wedding photos up there this year, with them up there, you know what I mean? But it's important that we do try and keep it safe as well, you know, the security at a level which will protect the building, and more importantly, the people in the flats around the back as well, that they feel safe within that area, because of the home enclosed at the moment, Alan, you know what I mean? There you go. Hey,
Convener, I should also add that I think the Sailors Society are taking their responsibilities very seriously. They've been in contact. We made contact with myself through Gerard, head of legal, in terms of the property and all the things that they should be doing. So they were actively looking for advice from the council officers in relation to maximising the security of the property. So they are taking that very serious.
Elizabeth? Louise is going to respond to your other question, Elizabeth. Louise?
Through yourself, Convener. I think it's important we drill down into the detail. Obviously, Councillor Jackson and myself received the information this morning in relation to, and I know as the chair of the programme board that we've had engagement with 241 children in relation to the health centre. But that's why I think it's important we give a bit of time for us to go away and look at it. And I'm only having a cursory look at it at the moment, and so until I go away and do that, but I will put it in the newsletter that I put round all elected members so that they can get an idea and a concept of what's actually happened.
Councillor McCabe.
Yeah, it was just to seek clarity in terms of who owns the health centre and who awarded the contract, and what role the Health and Social Care Partnership has in it, in terms of the sort of management responsibility, etc.
For yourself, Convener, obviously the Health Board own the building, and the contract, the money came from the Scottish Government, and we will be in the Health Board, a Health Board building, and people as tenants, if you like, in relation to, as will the GPs, the pharmacy, and a whole range of others. But it's a Health Board building. I was involved in the programme board and the development of the programme board to make sure that we got into the building and the building was built, and if there was difficulties or we were overspent, which we were quite considerably at the beginning of the process, that we were able to claw that back and make sure that we worked with all agencies to make sure that the health centre was built.
So the contract was awarded by the Health Board?
Absolutely.
And in a sense, if you were to look at the community benefits of that, then the issue is, how do you find the community? Is the community Inverclyde, which the health centre serves, or is the community the Greater Glasgow and Clyde Health Board area? So I suppose that potentially has an impact on the community benefits that might flow to Inverclyde.
yourself, convener. Yes, that's right, Councillor McKim.
Did that answer your question, Elizabeth?
It does. Sorry, I actually had a distraction there. It does answer the question in terms of doing further work and further analysis. And I take Councillor McKay's point, if it's a health board contract, etc. That's why the question I had was, where is our responsibility? But again, we either celebrate the health centre or we don't. You know, it can't be that everything that went bad about this project is on the health board and the Scottish Government, but we'll kind of be in a tilly celebrating the fact that we've got a new health centre. I think we need to be a wee bit more kind of grown up than that about the where we are.
Aye, you know, that's how it's important going forward. We do build a new facility down at Bassett. We try and talk to and make sure that it is the maximum benefit for the local people. You know, we don't miss the boat on the next project. If we can all agree on that, I think that's the way forward. Please, and you're in desk there.
Yes, of course, through yourself, convener. Obviously, we will look at that and we'll work with Stuart and making sure the community benefits in relation to the LD hub are what they should be in relation to the contract.
Yeah. Welcome back, Colin Jackson. The VPN crashed. It wasn't anything to do with yourself.
Okay, to my wee bit.
Right, is there any more questions on them items?
Yes, please, convener.
Right, Jim, on you go. Sorry.
Yeah, thanks. I'd like to add my concern with the others about 4.8 in the Great Health Centre. Can I thank Colin actually for raising this today, because it is a very important matter, and you know, I take on board what everyone said, including Councillor McCabe, about, you know, how wide is the community. But I think certainly we need to learn lessons from it, and that we need to be careful it doesn't happen again in the future. That, you know, anything like this, that Inverclyde benefits from it and not necessarily other areas and something like this. So, but it'll be interesting to find out more information, and obviously Louise has said that she's going to you know, bring further information forward about that. Regarding some of the points on page 4, Sir Gabriel Woods Marners Homes, it's great to see that all the residents have settled in other establishments. And a question I've asked in the past is, has there been some people who have made long-lasting friendships? They've been moved on together, which is good news. So I'm glad to hear that's happened. Question regarding the Marners Home though is about staff. This will be my first question. Is the staff, did they find jobs? Do you know if all the staff have found work in other places, whether it's a council or elsewhere? My second question is about day services respite unit. I know there'll be a further report going further forward, but I just wondered about any of the day services. At what stage would we start to see them open, even partially open, you know, with a few people? Would it be when we got to tier 1 or tier 2? So that's that question. And my last question is about respite services. I take on board that there's not been any demand, but I just wondered if there's been any cases for any emergency respite services. Is any emergency services taking place there? Okay, thank you.
Right, Jim. Colin, Alan, did you get any 3 questions?
Thanks, convener. I did. In response to question 1, staff, almost all the staff got secured jobs with other providers, and 2 staff left to go and do other things. They weren't care staff. There was a chef and an assistant cook. Both went on to other establishments, and we made an offer to interview all the staff. If anyone wanted to come, they were guaranteed an interview for care at home. That care at home is a slightly different job, obviously, from working in a care home. So the majority of the staff decided to go and take up and actually followed a group of the service users. So Councillor MacLeod asked about natural groups. A significant number of people went to one care owner or care home in Greenock, and a number of those staff moved with that care group and took up employment with the new care home. So you really couldn't ask for a smoother transition, but no one was made unemployed. Everyone picked up new jobs, and a couple of people have went and taken up other jobs in the kind of hospitality industry. So the Sailor Society did their best by the staff, and they were there supporting them as well in relation to going through that process. So I think that's been managed reasonably well. I think in relation to question 2 and 3, which are probably linked, Councillor MacLeod's completely right. There is only a very tiny green shoots of in people's minds that they feel as if they're moving to a safer place. And although we're there professionally in terms of that safe place, it's just going to take some time, and we wouldn't be doing anything radical. I'd always be coming back to committee to check out, but we have been doing some slight changes in relation to assertive outreach, Councillor MacLeod. So we've committed to just reviewing that activity to see what lessons are learned. But I think as confidence grows, we will be able to recover services the way we've done it very tentatively with the Learning Disability Service at Fitzgerald. It took many weeks for families to feel comfortable, and we had to put that same work in with families to assure them that we had all the safety measures in place, and that will be the same with the day services and with respite. There have been a small number of emergencies, and those people have chosen to go from one of the numerous care homes across Inverclyde, because we are in a position where we have a big range in terms of choice, that people can pick a care home for respite if it's required on an emergency basis. But I'll continue to work through the recovery process with the services, taking account of the legislative requirements, the stuff around all the safety aspects as well, and we will go at it in a planned and methodical way, and we won't take any risks with people, but we will start to make those plans. And I think it will be really interesting for the members to hear about some of the other ways we have been engaging with people through the assertive outreach. So Joyce is going to do that piece of work and then come back at a future date with a report to let you know what were the good parts about that assertive outreach, what the things people liked, and what did they feel they were missing. And that will help us as we move forward.
Thanks for that, Alan. And just to say that obviously, what do you call it, the Partly branching out is another organisation have had some service users back as well. But you're right, I think it'll be confidence. Certainly, it'll be a great barrier to break down as well. Okay, thank you.
Right, is there any more questions on the items? No, okay. 4.9 is the Inverclyde Alcohol and Drugs Recovery Service. And
thank you, convener. So the ADP has submitted a bid to the Cora Foundation as part of the Drug-Related Death Task Force. The bid focuses on early help in police custody involving peer navigators. We've received very positive feedback so far, and additional information has been requested to expand the project. We'd hoped that we might have had further detail by the time in between the report being written and this meeting, that we would have the outcome of the bid, but we haven't as yet. But as soon as we do, we will update you. But the response has been very favourable to date. An update on the interviews have undertaken for the independent chair of the ADP, and we have a preferred candidate who's going through the safer recruitment process. Hopefully they'll be in post maybe mid-May to late May. The other further update is about the drug death research analyst. You know that Dr. Tony Martin would normally give an update on the analysis of the drug-related deaths. Unfortunately, due to difficulties accessing the information because of COVID and the delays in the toxicology and the inability to get into Glasgow University to access the database, there's been some delay in him being able to provide that analyst, but we're working hard on that, and he's hoping that he can present that towards the end of June, and he will include some of the analysis of the homeless data in that same presentation, because some of them, there will be overlap in that client group. And that's me.
Thank you. Anybody got a question for Anne on that? Jim? Judge McLeod?
No, I'm fine, thanks, Robert.
Okay, right, thank you for that. And we'll move on to the Learning Disability Hub Development. Alan?
Thanks, convener. Through yourself, just to assure the committee we are making progress. We're working through the concept design stage still with our technical colleagues at the council. The couple of live issues at the moment are around work with SEPA, around the flood maps and flood management. So Eddie and Stuart and the team are in negotiations with SEPA to work through some of the technical details around the flood areas and what that might mean for the project moving forward. And there's an ongoing legal process to go through in terms of with Ardgowan Estates, which we are making progress. And again, Stuart and the team are working through that. And we're obviously keeping the engagement with the service users and their families. Are all very excited about the possibilities that we've got in terms of this build, taking account of also what the members have been saying. That's something else to make sure we're mindful of when we get to that stage, but we are in the finalising of the design stage from the service perspective. And then Alan McClintock and the team have got specific pieces of work they're doing with the different consultants around this. So again, we come back to every second committee normally with an update on the LD redesign, and I'll obviously update the committee when I've got something to report on next time round. Thanks, convener.
Councillor Doreen?
Thank you, convener. Alan, have we got any idea of when we're anticipating starting work on the site?
Convener, through yourself, I know our technical colleagues talk about seasons. The original season was the tail end of this, going into the winter time, so you'll just be taking account of any delays that have been carried forward in relation to the work with SEPA. Members will know, for example, as a practical issue with SEPA, they were subject to a hack in terms of our IT, and Stuart and Eddie tell me that the work with them is quite slow because of that. They're not responding as quick as they would have because of the technical problems they have, but it was originally to break soil at the end of this year, the winter time, so they'll factor in what any delays, and as I said, maybe next committee I'll be able to come back with a further update on what that implication would be given the work with SEPA. Less of an issue with Ardgowan. There's just a process to work through with Ardgowan in relation to the land, so I suspect it's going to be really around the work around the flood management implications of that site that we have to work through and make sure everybody's comfortable with. But that's why we put the money aside to do all these investigations, and that's proving its worth because we have came across an issue now and we're working through that issue to make sure the site's secure.
A supplementary question, Alan. I noticed that the site as it stands just now is being used by some building supplier to store goods in. I take it they'll be on notice to leave when we're ready to start.
Yeah, convener, through yourself, we have a group in there, obviously the butterfly and the all the stuff that's going on with the preservation of all sorts of small animals. So that a lot of that stuff is relation to the work that's going on there with the bees and the wasps and whatever else. But we're working with that group. We absolutely want them to be part of our offer in relation to that. So that'll all that stuff will be tidied up and moved off the site, Councillor Doreen.
Okay, I'm talking about all the building materials, no
Yes,
bees and
yeah,
stuff like that.
yeah,
Okay.
yeah. That'll all be moved off the site.
That's fine. Thank you so much.
Councillor McLeod?
No, I'm fine, thanks, Robert.
Thank you. Right, thanks for that, Alan. 4.11 is adult support protection inspection, which is another agenda item, the next agenda item. So I think we'll just gloss over that one and go on to Sharon, who's going to talk about the promise. Sharon?
Apologies, I couldn't get my mouse to work. So no apologies. The promise I've spoken at a number of previous committees, but today there's really good news to share. It. News is in the papers, but just to flesh that out for members' information and scrutiny. The vast majority of areas across the country were given an opportunity to bid into what was called the open applications, where a sum of £50,000 was available. I think the support that we've had for
breaking up, Sharon.
Both from Louise and from myself in terms of the strategic work and strategic work, authority.
Sharon, we're having difficulty.
Can you hear me?
You're breaking up and you're getting a wee circle going mad now, so you're lost now.
Councillor Moran, if it's helpful, I can maybe update on Sharon's behalf. I'm sure I can answer the questions as well as Sharon can, but maybe if Sharon comes off camera, you might be able to hear a little bit better. Sharon was alluding to the fact that every local authority area across Scotland was asked to bid for 50,000 in relation to a cultural shift. Because Sharon was in fact on the board for the care review, and because of me being actively involved in a number of things in Scottish Government in relation to specialist children's services, they asked us, we were invited, we were one of 6 who were invited to apply for 200,000, and we're delighted to be successful in relation to that bid. This is a bid that relates to 2 parts of the promise, which is the pledge, nothing about me without me. And that's really in relation to our Proud to Care group and how active we are in co-producing things with children and young people who are care experienced. And also Help Me by Helping My Family. And we have an award-winning birth ties group, which has been looked at across the country. And we're going to use these 2 to be the kind of foundation to build what we are calling I Promise. So the national review is called The Promise, and we have developed I Promise. And Sharon and the team will bring back a full report about how we're going to spend that 250,000. It should be noted that 250,000 is not about service delivery, it's about creating a cultural shift. So changing people's mindset about how they think about care experience, young people, and also how we think about supporting them and their family. And Sharon and the team will bring a fuller report in time about how that 250,000 will be spent. She's also going to ask the IGB for additional money in order to try and support this. Happy to take any questions.
Any questions on the promise for Louise or Sharon? Jim?
Robert, can I just say that, no
yes.
questions, but can I just congratulate Sharon and her team in the successful bid. Well done.
Thank you for that, Jim. Okay, right. If
Mr. Moran, I was going to see if you could hear me. Can you hear me okay?
We can hear you now, Sharon. On you go.
I was going to say Louise did an okay job there. The one thing I wanted to add was that a couple of members last time asked specifically about your own role, and part of the report that will be brought back will include an outline of the asks of elected members as promise keepers, and we will be developing that as a theme, and that links to the I Promise, the Inverclyde Promise, and utilising that whole concept about I Promise, so that it will be developing the role of corporate parents into promise keepers and how you link into the Inverclyde Promise. And I'm really looking forward to bringing that part back and also utilising that opportunity to hear from elected members what you think you can contribute to that role of being promise keepers. So we're quite excited about that.
Thank you. Anybody? Elizabeth?
Thanks, convener.
Elizabeth Robertson.
Hi, thank you. Shannon, thanks for adding that wee bit. You're right, Louise did okay, but you added the bit that I was going to ask a question about, so that's helpful. to kind of know that we're going to be able to close the loop on that and have that clear sense of what our responsibilities are. That seems to be my theme for the afternoon. What we need to do to be, as you say, promise keepers. That's really helpful. I'm going to ask a question, and it's probably very rhetorical, but I kind of want to ask it to not have made an assumption. If there's a report coming back outlining how we're going to spend £250,000 plus any additional money that we get from the IGB, is that going to be very clearly articulating what our young people are saying we should be spending money on, and what their families are saying that we should be spending money on, because they're obviously the kind of key stakeholders in terms of this particular investment? And again, if that is yes, if the answer to that is yes, and I think it probably will be, but I don't want to assume, that's why I'm asking, then I think things like this with additional pots of money are a really good way of showing how we can do this type of engagement and get real, genuine bang for our buck with the core budgets that we have when we talk about things like PB and things.
On you go, Sharon.
So a qualified, yes. The qualifying part of it is this will utilise the Scottish redesign methodology, Councillor Robertson, that will build on the participation that's already taken us to this place. So we know the direction we're going in because of our participation, principally with young people. We have much more to do with parents. And that goes back to the 2 points that Louise was making there about these two concepts of nothing about me without me comes from our young people. That's their key message. And help me, help my family is their other key message. Those are the two things that they want us to focus on. That's why we've got Proud to Care Group, because that's where that came from. That's why we've got Birth Ties, because that's where that came from. It came from the views of our young people about what we needed to do more of and better of. So the money that we're getting will not actually be spent on the service redesign that young people will specify. The asks that we've made of the Cora Foundation are that, so the report that will come back will be for staff to then do this engagement work to an entirely new level, of innovation and creativity, community-led and community-based. But what it will do will be bringing back powerful and challenging and bold messages for managers and for members and for the local authority as a whole about how our core spend should be utilised. So it's likely that it will bring back really significant shifts in how we're delivering our care service. And by our care service, I'm talking about family support as well as services to look after children. And that's the whole emphasis that the promise are directing us to. And I mean, I say this because I think that it's important, and we'll talk about this more when we do the full report. This next stage is a 3-year plan, and if we don't make substantial shifts in this 3 years, those shifts will be imposed on us from a central notion. So we are strongly invested in our young people directing and our parents. And I say we've got more to do in relation to parents, what our core spend on this should look like. So no to this money. And although it's been directed by our previous engagement, but the whole thrust of this is making sure that the voices of children and young people are what is core to future spending plans.
You happy with that reply, Elizabeth?
It's an honest answer, but it does answer the point I was making. You know, it's an opportunity. It's been shaped by what our young people have said, and it's going to make things more embedded in core. So that's to be applauded. Absolutely, thank you.
Okay. Jim, you get any questions on the promise?
No, that's fine. It was great to get more information out from Sharon. Thanks.
Thank you. Move on to 4.13, the Health and Social Care Revenue and Capital Monitoring Report. So we have Angela, you ready to talk us through this one?
For yourself, convener, I think it'll be Samantha.
Oh, Samantha, sorry.
Convene this for yourself. The projected revenue outturn for social workers at the 28th of February is an underspend of 40,000, which is a reduction in the projection of 730,000 from the position we reported at period 9. The main areas contributing to this reduction are within residential and nursing care client commitments, an increase in the underspend of 56,000, which is as a result of the reduction in bed numbers being projected. These were at 515, now down 10 from those anticipated at period 9. Within external home care, we've got an increase in the underspend of 132,000, which is due to a combination of a client moving to another service, the allocation of costs to COVID, and a projection error at period 9. We have additional Scottish Government funding of 66,000 within children and families, which is covering core costs that were included in the period 9 position that we reported to committee. We have an increase in the underspend of 392,000 within employee costs. 289,000 of this movement relates to additional funding received from the new social work monies held within corporate director. The balance of the movement in the main is due to increased turnover savings due to slippage in filling vacancies from those we anticipated at period 9. And finally, within learning disability client commitments, there's a reduction in the overspend of 49,000, which is mainly due to the allocation of costs to COVID. Moving on to capital, the revised capital budget for social work is 149,000, with spend as at the 28th of February of £115,000, which equates to 76.87% of the revised budget. And finally, earmarked reserves. The projected earmarked reserve spend for 2021 is 5.214 million, with expenditure 3.1% behind phased budget as at the 28th of February. We can take any questions.
Thank you, Samantha. Anybody, any question on the report? Councillor MacLeod?
No, I'm fine, thanks, convener.
Well, thank you very much, Samantha. The next item on the agenda is the Cross Hill Children's Home. Have we got somebody from the planning, the building department to talk to, or no?
There's no anybody here today.
Right, Sharon, you want to give us an update on?
Yeah, are you able to hear me okay, Councillor Maranaha?
Yeah, I can hear you clear, no bother, quite clear.
We're anticipating that there'll be somebody on site from June with a 26-week time frame for completion. So that's the time, the scheduling of that isn't good, but in terms of where it takes us to, but we will work around that, and we're just delighted that the project is moving again.
Aye, well, that's great news, you know, because I know that the young people are really disappointed, and the members of staff, obviously, when they thought of moving a new facility and it fell on its head because of the company crashing. So that's really good news, Sharon. Anybody any questions on that Cross Hill Children's Home?
Yeah, Robert, can I just say that I echo what you've just said yourself, that it is good news that eventually we're going to see in a month or so's time, work commence here again, because it's been not through any fault of our own, but it has been a long time coming. So yeah, absolutely, I'm sure the young people and the staff will all be looking forward to going back home again.
Thanks, Jim. We've another thorough update on the new learning disability facility, Alan. I think you're on mute, Alan.
Apologies, convener. I think I've alerted the members to the two main issues around SEPA, which is work ongoing, and the work around the work with Argown, which is ongoing, and Alan and etc. have put on updates on the design and structural engineers and quality surveyors. So that work's all progressing, convener.
Right, thank you, Alan. We'll move on to agenda item number 3, which is the Inverclyde Adult Support Protective Partnership. The feedback of the finding from the completed joint inspection activity. Alan Stevenson.
Sorry, can I interrupt, Councillor Moran? Can I check that you're accepting, that the members are all accepting the recommendations in the agenda item 2 in the report?
All right, okay.
There's the list of recommendations.
Everyone agree with recommendations?
Agreed.
Thank you, convener.
Well, thank you, Vicky, for keeping me right. Item 3, Alan, on you go.
Convener, thank you. Through yourself, this is the update on our Inverclyde Adult Support and Protection feedback. I'm very happy to come today and explain a wee bit about the inspection. It's been a very unusual time for us. Members will remember we started the inspection last year, and then the Scottish Government pulled back from inspection activity, and ourselves and another partnership were underway in relation to the inspection, so that process was paused. I had a discussion with Louise, and we were keen to go back to the Care Inspectorate and say, is there any way that we can complete this inspection to give us some external assurance around our activity around adult support and protection? And the Care Inspectorate came back and said, well, yes, we're looking for a pilot area to work with us to look at the new methodology about carrying on an inspection where you're not allowed to go and put feet on the ground, and it would, a lot of that activity would shift to an IT solution in terms of remote access to case files and studying our activities. So delighted to say that we worked alongside the Care Inspectorate. They tested out their methodology with Inverclyde, and the inspection process for the rest of Scotland is just kicking off now. But if you like, because we put ourselves forward to assist them to test out that methodology, this is our inspection, and the Care Inspectorate will go on now and use that methodology with other partnerships across Scotland. So delighted, and that was built on, like every inspection, you get an opportunity to put advanced information to the Care Inspectorate through an advanced statement. So we did a self-assessment, and we told the Care Inspectorate what we thought our strengths were. We told them where we thought we still had work to do. They read 50 of our case files. They read 40 of our initial referrals around adult support and protection, and none of these cases were escalated through that process. If the Care Inspectorate have an issue with a case, they can escalate it to the head of service, and that will be discussed. So we came through this process. They reviewed 50 files and they reviewed 40 referrals, and none of these were highlighted as any significant issues in relation to our practice and how we went keeping people safe. Under 2.6, you'll note at the bottom, which I think is quite significant for members, that they said, based on the evidence, the inspectors reported that adults subject to adult support and protection experienced a safer quality of life from support they received, and furthermore that adults at risk of harm were supported and listened to keep them safe and protected during the key processes. So that's external assurance and telling us that the Care Inspectorate, there was many aspects of our practice that we're pleased with. But like every inspection, members will note under section 7, they did come back and say these are some of the things that you're absolutely right from your self-assessment. We think you do need to work on your chronologies. You do need to look at some of your key processes and just iron out some areas where we think you can make some progress, and issues around quality assurance. The significance of those findings are that we already gave that information to the Care Inspectorate. We told them that as part of our own self-assessment, that these are the things that we need to work on. So I'm very pleased that they come back and said, yes, we do agree. These are the things you need to work on, and you need to pay particular attention to them, and through the improvement plan that's attached to the report, I hope that gives members assurance that we are already working on the areas they identified. But just on section 7.3, they also highlighted the strengths in relation to that in terms of the staff survey. We got very positive feedback from our staff across nearly every single one of the questions. We were getting really good positive results in terms of what staff made of our strategic leadership and how they are supported to do their job. They spoke very well about the good partnership working, about Health's contribution and Police Scotland's contribution through the hub. So all in all, it's not been a straightforward process to conclude this review and inspection of adult support and protection, but I am very pleased that they picked Inverclyde to allow us to complete the inspection, and there's been a lot of work done by the staff to make sure we assisted the Care Inspectorate to test out this methodology. We will now focus on the improvement plan. One of the things about this inspection is you'd normally expect to get grades. They're not providing grades this time, but they have in the last week or two confirmed that we should expect to get the formal report back by the summertime, as they are now starting to work on other inspections. So the feedback was given to the Chief Officers Group, the Chief Executive. We have shared our improvement plan with the Care Inspectorate, and they have pointed out a couple of minor changes for us, and they're content with the plan we have, and that will be monitored through the Adult Support and Protection Committee, and our independent chair will also make sure that we continue to make progress in the areas that have been identified. So I'm pleased we have concluded the process, and there is something robust about getting feedback from an external agency like the Care Inspectorate and Police Constabulary. So we will take that now as a firm basis to move forward now and secure these improvements that they've highlighted to us. And I'm happy to take any questions.
Thank you. I'll forward a question. I think Sharon wants to add some more to the report. I'll forward a question. Sharon?
Thanks very much, Councillor Moran. Members will be aware that in recent years, much of the focus of inspection has been on the services that I directly manage. As Chief Social Work Officer, you'll know that I've got a quality assurance remit in respect of all of our social work services. And I think there's a couple of things I would like to add specifically to the points that Alan has made. This, even although we are now quite a mature health and social care partnership, this is really only the second proper scrutiny that we've had around these areas since we've become a health and social care partnership. I will do. Something really valuable to be gained in terms of the assurance that we've been offered from this this piece of scrutiny in relation to our services as part of an integrated set of arrangements, and I think it's really important that we take that assurance from that. The second thing which I'm going to highlight, because I think it would be very difficult for Louise and Alan to say, is that the emphasis that was placed by inspectors on the strategic leadership services, and they focused frankly on that strategic leadership from within the HSCP, although this inspection looked across the range of adult support and protection services. There was specific reference to the strength of strategic leadership, and again I felt it was important that members were cited on that and had that assurance. And certainly from my position as Chief Social Work Officer, I've certainly a degree of confidence in the assurance that's been offered through this inspection.
Thank you, Sharon. Has anyone got any quick? Gerard Doreen, Councillor Doreen.
I think the services has actually got to be congratulated for being so innovative and cooperating and doing this analysis. It's a very positive outcome, and I think all the staff and senior officers are to be congratulated. Thank you very much.
Thank you very much for that, Councillor Doreen. Councillor MacLeod.
Yes, thanks, Robert. I mean, like Jerry, I agree. I think the service is to be congratulated particularly as this is a new initiative, a new way of doing things, and you know, for us to be the first local authority to work in doing this with the Scottish Government, I think is tremendous, and I suppose groundbreaking. So it is. So you know, congratulations to everyone involved in the process. I just wondered though, sorry if I maybe I picked this up wrong, but Alan, I think you'd said about the grade system, the system for how things were graded, it wouldn't be used on this occasion. Will it be restored again, you know, the 1 to 6 system, or is it going to be replaced by something else?
Convener, through yourself, thank you. I think the Care Inspectorate were quite clear, because this was a 2-year programme to look across all the areas, and then from that piece of work they will look at what their priorities are, having assessed all the partnerships. So Louise sits on the National Group for Adult Sport Protection, but from my perspective, I know, and we had to let the Chief Executive know, they were never going to grade, so you don't get your 6s or your 5s. I'm not sure yet, after the 2-year process, when they move on to the next set of inspection activity, whether they've confirmed yet or not that they will move back, because I think they do appreciate it's numbers are easier sometimes to get your head round than just narrative, but for the purposes of this first sweep across Scotland, that they had already confirmed they weren't going to look at a traditional grading structure. They were going to give us feedback with some level of assurance. So I can check, Louise might know, but I'm not sure if it's been confirmed yet, whether in 2 years' time, when they start the next process, whether they'll revert back to a grading system or not.
Louise?
Through yourself, Convener, Alan's correct. They've not made a decision in relation to that. They'll do a thematic review after 2 years, and then we'll decide whether they're going to move to a grading system or not. And by that point, the Care Inspectorate may well have changed its inspection processes anyway.
Yeah, can I just say that? Yeah, I mean, it's great. Obviously, getting this feedback, and we can. It's reflected in the narrative about how well we're doing, or other local authorities are doing or not doing, whatever, in various areas. But I think it did make things kind of simple and easy. You know, it gives you some sort of assurance about how well we're doing. Might have been a simple way of doing things, but certainly for me, you know, I think grades was a good system, a easy system for, you know, to pick up on, and to see maybe what areas we're falling back on.
Right, Louise?
Through yourself, Convener, just to give Councillor MacLeod some assurance, we did try and push them for grades, and having been involved in a number of inspections in a number of places, you can usually tell from the language whether it's a 6, it's a 5, or it's a 4. So we did, and the Chief Executive of the Council did try and get them to give us grades, but they weren't having any of it, and I don't think, but I don't know we don't know what will happen in the future.
Okay, thank you.
Councillor McCabe. Stephen?
I think Councillor McElhenney's before me.
Oh, sorry, Jim.
I always defer to my elders.
It had been the broad right of the Sharon one. Okay, sorry, Councillor McElhenney.
Thank you, Stephen. Thank you, KB. It must be all that weight I've lost. Just becoming invisible.
It is, Jim.
I'd like to congratulate the service on a thorough and, dare I say it, quality improvement plan. But I've got a wee question as to, I know all the status and the comments, they're all down as green, but some of the comments I would have thought maybe shouldn't be green, they maybe be changed to, for example, to closed or some other type of word. For example, I look at action 2A, agree new procedures as the action required, and the comment is draft procedures in place. I thought that action would have been closed out. And it's similar to that throughout the plan.
Convener, through yourself, thank you for that, Councillor McElhenney. Yeah, we'll look at that in terms of, we might bring a blue status onto the plan. This was the draft that the care inspectorate have said they're comfortable with, but we can use another colour or maybe two colours once we get into the monitoring of this report. I think if you bear in mind also, it looks like a rosy picture, but it's only because we knew about these improvements and we were working on them. The criticism, if you like, or the feedback the care inspectorate said was you should speed up. That's fair enough. We will be able to pick up pace now as we move into recovery, but we also pushed back to say we were occupied with trying to save people's lives. We were trying to keep folks safe, and undoubtedly that's had an impact across Scotland on folks' ability to carry out the improvement work. So it's a very good point. I'll take that back to the committee and we can look at maybe introducing a blue colour to say, well, that's actually been completed now, and they said it will be monitored through the Adult Sport and Protection Committee.
Yeah, and I'm taking it they're all the status is all green because we're expected to meet the timescales, the dates that it's given. Whereas if there were any doubt, then we would be changing the green to an amber type thing.
Convener, through yourself, that's absolutely correct, Councillor McElhinney.
Well done, Jim. Councillor McCabe.
Yeah, thanks, Chair. I mean, I think it is obviously a positive inspection report, and I would obviously commend everyone involved in achieving that. So it would be useful maybe just to get a sort of an understanding of the numbers of adults that we're sort of supporting and protecting at the moment, and how that has maybe changed over the years, and the sort of the degree of risks, I suppose, that there are in terms of facing these particular adults, and how does that feed through into sort of the resource demands that are then placed on the service and partners, and how that then feeds through, I suppose, to our capacity to improve. It's all well identifying areas where you need to improve, and obviously you aspire to improve and you aspire to deliver high quality services, but you need the right people, the right resources to be able to deliver that. So it'd be useful to get an understanding of just overall the sort of scale of the service and the demands on the service, and how that feeds through into our ability to drive improvement.
Convener, through yourself, thanks for Councillor McCabe. Yeah, it's interesting. So during the pandemic in adult services, we haven't seen a huge rise in activity around what we go on to look at adult sport and protection, case conferences, etc. What we have found though is an increase in the welfare concerns that are coming through. We've been discussing this in our recovery conversations, and one of the services that we launched last year was called Access First, and you may have seen it through some of the social media. That's we now take all our welfare concerns and adult protection concerns through that first point of contact, Councillor McCabe, which gives us a much better and robust and standardised approach to the referrals we get, both within the services, if you like, from GPs, from consultants. So the Access First, where we have a number of staff, that we call it the so-called front door. There's this single point of contact, which is actually, it's a bit of a clue into how we might come through recovery, in terms of if we can put resources at the front door and get people to the right place at the right time. It allows the specialist teams to concentrate on getting through the adult support and protection work that requires investigation and case conferences, and perhaps that kind of level of activity between 1 and 5 cases a week. But welfare concerns are a considerable amount of work that people are worried about. Adults, they come through in a welfare concern, and our Access First team gather that information and then make sure it gets to the right people at the right time. The Adult Support and Protection Committee, we look at all the stats every month in relation to looking for trends. It may be something the Health and Social Care Committee might want us to bring back a report just to show what the level of activity has been around during COVID and the results of COVID. But certainly in terms of our capacity to meet demand, we have been doing that, and I think it's because we've invested resources at the front door to make that first point of contact more effective. But there certainly hasn't been a huge spike in activity. And again, that's down to the work we do with our police colleagues at Renfrewshire at the hub. We are much better now at making sure those referrals that are coming through are appropriate. What you will find is there are a significant number of people who generate a significant amount of work in the system, and it's our job to try and make sure those people who are really vulnerable, that we are wrapping support around them. And that's when case conferences come into play, and you're making sure you've got a protection plan for these people. But we've already started that work, and to answer your question, the resources we've put at the front door is making a difference to how we're able to release staff and the specialist teams to actually work on the more serious casework that results in adult support and protection referrals.
I mean, that's useful. I mean, I suppose I'm not so much focused on COVID, but maybe sort of the longer term trends. I mean, we tend to see adults with learning disabilities living longer these days, and the population in general is living longer. But as we've seen in reports, living longer with poorer health. We've seen obviously increase in diagnosis of dementia as well. It's just to get an understanding in terms of this sort of, I suppose, the scale of the caseload. Are we seeing an increasing caseload, more people that are vulnerable that need support and protection?
Vina, through yourself, yeah, I would say to you that the complex cases are getting more complex, so they are more multifactorial because you're bringing in even more complexities around how families are made up now, the lack of support for some families that maybe traditionally, so there's no doubt that the more vulnerable people, when we are dealing with the kind of high-end risk cases in adult support and protection, the risks are higher because that natural support isn't there. But the biggest increase, I think, is in people's understanding of adult support and protection. Some of the campaigns that we've ran around seeing a chap at the cash machine trying to take money out and the guy standing on his shoulder. So I think awareness of adult support and protection is definitely making a difference to people's understanding of what's acceptable and not acceptable now. And there's a general, we are far busier now with welfare concerns, folk generally worried about people maybe at a lower level. But I would certainly say to you, we've got that piece of work going on, and generally some of the complexities around that people are facing now. Councillor McCabe, there's no doubt about it, there is less natural family support around, and these particular individuals are very vulnerable, and that's when we put support plans in place to keep people safe. We can go to the Sheriff Court and get guardianships in relation to people if we feel there isn't anyone looking after folk. So there's a whole range of interventions. The Mental Health Act as well come into play for a certain groups of people as well. But generally, I would say there's a better understanding now of the welfare concerns issue, and that is creating more work for us. Part of that is to make sure when we have that first contact at the front door, we're getting these people to the right support first time, so there isn't any waste around the system and people getting referred to one place to another. So I would say the Access First team is definitely building that capacity at the front door and getting that help to people first time is something that I would want to build on, kind of moving forward, looking at that model and using that as a way to meet some of the future demand that's coming our way.
Okay, thank you.
Convener, could I come in just 1 second, please? Robert?
Councillor Moran, you're on mute.
I'm saying, Jim, you'll have to ask your boss because she's next for the question. Elizabeth, if you want to let Councillor MacLeod in.
I've scrubbed my question. I had a question and then it got answered, so I'm fine.
So, okay, right, Jim, the floor's yours.
Okay, thanks, boss. Yeah, it's on the back of what Stephen sort of asked there is, have we seen any increase at all over the last year with COVID? Has that made things more difficult? And what is the service doing around awareness to, you know, make people aware of difficulties that could arise for people, and also you know, how, you know, make people aware of who they can go to for help? So around awareness, what we're doing in that direction.
Alan? Convener, through yourself, Councillor MacLeod might be aware that for a significant period before Christmas, we asked Your Voice to work with us to publicise some of these scenarios that I spoke about. So, for example, an adult standing at a cash machine picking out money and somebody standing on their shoulder. So Your Voice also have an adult support subgroup as well, and we've been liaising through that to get ideas on how to engage with people. But the awareness raising has been done at a local level in relation to our engagement work with Your Voice around that social media campaign mainly, and that's how we've tried to tackle that in relation to getting out. I mean, we've got all the stats and figures on that. It's an incredible amount of hits that Your Voice have received on the website when we've ran this campaign, and you just keep that campaign on a rolling basis. You run it for 3 months, you pause, and then you go again. So that campaign ran right up till Christmas time, and then we'll again in the summertime we'll run that again. There's some scenarios. There is some national leaflets available that we have in offices, and we have it online as well in relation to access to resources. In relation to the COVID, there's not been a huge spike in activity around pure adult support and protection, but what I'd say, Councillor MacLeod, is the general public are getting much more aware when they see things that don't quite look right, and that whole having a concern for somebody, and that usually results in a referral to our Access First service, and then we will look at that and see if there's any particular issues that we can intervene and assist with. I think it would still, to be fair to say, there is a level of suspicion around, and sometimes you have to work with families you have to put a lot of work in with some families who don't see there's a place for statutory services to be getting involved, but that's just part and parcel of our social work and nurse training, that you work through those issues with the families. But I would say, in general, the welfare concerns, there's a far greater awareness now. People kind of know when things don't look right, and they are starting to come forward more in relation to reporting that, not as an adult protection concern, but just saying they're a bit worried about somebody. And that's when our teams will then triage that and have a look at the information. And if we have to have this duty to inquire under adult support and protection, we will go and we will look and we will find out information to give us assurance that there is or there isn't something that we can do to assist. So definitely watch out for the ongoing work around Your Voice, because that's been very successful, and we're reaching, the reach is far and wide. Your Voice get a lot of attention on social media, and that's proved to be a good strategy for getting that message out there.
Thanks for that, Alan. Yeah, and obviously, I mean, one of the things we're seeing a lot of people being, you know, contacted with a lot of scams going on as well, and obviously people who are perhaps vulnerable or with learning disabilities, particularly if they're living independently. You know, obviously it's about making them aware of these things as well. So, thank you.
Please.
To yourself, Convener, and just picking up from members some of their inquiries, it might be helpful for us to bring a report back on activity in relation to complexity in the future. I would rather wait until everything opens up and we're quite careful in our analysis about what happens when the communities start to open back up. But I think members might be interested in what's happened during COVID and how that compares in relation to. And so we're happy between Sharon, myself, and Alan and Anne will bring something back to members maybe in about 6 months' time, and I think that would be quite interesting.
That would be great, Elise. Everyone. I think that was a message. I think my tea's ready. before we go to the next item, I'll move the resolution. We'll get into private session for 4, which is the governance of HSP commissions, external organisations, and if you remember the public listening or otherwise, please leave and we to item 4. Okay. Right.